Thank you, Celeste Lipkes, for returning to give us the follow-up impression after your general surgery or after your surgery rotation. What we'll do is we will have you listen to your previous interview and respond to your previous answers. How do you think you're going to like it?
I'm nervous, but I'm excited. It's going to be my first rotation, and we have an 8-week rotation with two specialties for 2 weeks each, and then a general rotation. I'm going to be on neurosurgery first, start
Wow.
with the basics, brain surgery, and then going to vascular and then pediatrics for 4 weeks. So I feel really lucky that I got the specialties that I requested. I'll be at the Veterans Hospital for the first two, and then at my main hospital for the pediatrics one. So I'm excited, but I've never been in a surgery before, so I'm a little bit nervous to see how it goes.
So what makes you nervous about it?
I think I sort of struggled with anatomy, to be honest, and so I wonder if that's going to sort of follow me into the OR. I am really eager to learn. I think being more hands-on will be helpful for me. It was hard to sort of learn from a textbook. I'm not really that kind of learner. So I think being and seeing everything, in front of me and having someone explain it, that's really helpful for me. Anatomy was difficult because we were on our own for a lot of it. So I think having the mentorship of physicians and surgeons will be really invaluable.
So let me ask, did anatomy end up seeming relevant or feeling weak in anatomy seem to be an issue at all?
It was an issue in terms of, I don't really like the phrase pimping, but it's kind of what we say, getting drilled on questions during surgery, especially on the laparoscopic surgeries, where it's much easier for the surgeons to ask you anatomy questions because you're actually visualizing everything very well. I had a lot of trouble with that. I'm sort of very poorly spatially aware in general. And so it took a lot of effort for me to kind of catch up on that. And in some ways, I feel like I never really caught up, but I was able to grow in other areas more. I am really eager to learn. I think being more hands-on will be helpful for me. It was hard to sort of learn from a textbook. I'm not really that kind of learner. So I think being and seeing everything, in front of me and having someone explain it, that's really helpful for me. Anatomy was difficult because we were on our own for a lot of it. So I think having the mentorship of physicians and surgeons will be really invaluable.
It sounded like you were implying there was a kind of learning you were expecting. Did that come to
Yeah,
bear?
I think I had very different experiences at the VA versus at my home institution. And I'm sure we'll talk about this more, but at the VA, there were fewer students, so I felt like there was much more individualized education. And we got basically more free reign in the OR to help because there were less people. So that was a positive there, and I felt like I did get that kind of educational experience in the OR. But in terms of my home institution, being on the floor and seeing post-op and pre-op patients, I did feel like there was an advantage to having a very strict hierarchical system, being forced to really know your patients very well and to be ready for any sort of pimping questions from the attending when they come by. That was more helpful sort of doing floor work. So I felt like I did get a good mix of those two types of learning by being in those two different environments.
Okay. And did you choose to do your surgery rotation first?
I did, yeah. That was
Why was
my
that?
first track request. I knew that it would be the hardest schedule, so I sort of wanted to just. I figured if I did it first, then everything after that would seem a little bit more luxurious in terms of time. I also thought that I wanted to be on surgery rotation with students who weren't necessarily going into surgery, but still really wanted to learn. And I thought putting it first would be helpful because I don't know, the sort of wisdom that they tell us is to not put what you want to do first. And I thought that there would be sort of maybe a a more friendly environment to students like me who don't want to go into surgery necessarily, but still are very much there to learn.
But was doing surgery first, you think it was a good call? Do you think it makes a difference?
Yeah, I'm really glad I did it first. In some ways, it felt like running straight into a brick wall, especially starting on neurosurgery. I think my first day in like on the floor, it was like a 9 hour surgery on my first day. So I think it was very good in terms of like just throwing me in. And in terms of helping me on other services, I feel like it's been super, super useful. Having pediatric surgery before doing peds was wonderful. Right now I'm on OB-GYN, and like being in C-section was so much, I got so much more out of it and felt so much more comfortable having had surgery first. Um, on the other hand, having sort of a background in medicine and internal would have been very helpful, especially for the shelf exam, which I think is pretty common knowledge that the shelf is very internal heavy. So that was one disadvantage, I think. But I am really glad I had it first.
So what do you look forward to on this rotation?
I'm really looking forward to my pediatric rotation most, I think. I am really interested to see how surgeons sort of explain the surgery to the kids and then how that process differs from the adult surgeries. I think the whole pediatrics, like navigating between the parents and the children is a really interesting dynamic. So I think my interest in surgery is more in the communication. I mean, obviously, I really want to attain the knowledge and the skills of the actual techniques, but I think issues of like consent and stuff like that are very close to me. So I'm interested to see the sort of communication that goes on between surgeons and patients.
Interesting.
Yeah, I actually didn't end up seeing that many consents being sort of arranged. I think that is something that a lot of the residents end up doing, like very early in the morning when we're sort of doing other things. I did see that on neurosurgery for deep brain stimulation cases, and that was very, very interesting. And seeing the whole process of obviously coaching the patient through the fact that they're going to be awake during the procedure and sort of what's going to go on during the procedure in a way that you would never do for a normal surgery, because it's irrelevant. The patient doesn't need to know all the steps, but when the patient's awake and you need their cooperation and need them to be calm, like that was a really interesting thing to see. I didn't really see it on peds.
Tell me what you don't look forward to on your surgery rotation.
I think I don't really know what the hours are going to be like for each service, but I anticipate they're going to be very long. So I think that's something that I'm sort of a little bit hesitant about, because I do really value having some sort of balance in my life. That's always been a priority for me in medical school. And being an older student, I think and having done things before medical school, I think I really prioritize, making sure I'm taking care of myself and all of that. So I think that might be my biggest challenge in terms of working these long hours and then making sure I'm keeping up with the material for the shelf exam, but also, bathing and sleeping and doing all the things that you need to do.
So have you heard that it's a hard rotation in that sense from the hours?
I have, yeah. I guess it depends on the service, but I've been told that we start rounding at 4:30 or 5, depending on the service. And then I've had friends come home at, 7 or 8 p.m. at night. So I'm sure it varies depending on each individual physician service, but that's sort of the general idea I have going into it.
How did that pan out?
I was very lucky to have the help of my significant other in terms of eating. That was I spent a lot of time, probably in like the hour and a half I had when I got home before I went to bed. Besides studying, I was very careful to pack a lot of food and to unpack everything that I had eaten during the day. That sort of kept like a little bit of sanity going for me. Besides the fact that I have low blood sugar and I know that I need to eat a lot, just making sure that I was taking care of myself in that way was helpful. And just having the help of someone else, I think was really key for me. And friends who I've had on surgery, if we're on, if, one of us is on a lighter service, we'll try and reach out to them and say, like, can I bring you a snack or something? Just because that is just really helpful when you're working, 14-hour days and you don't have time to take care of yourself.
But in but did the rotation seem hours heavy the whole time?
No, it didn't. I think being at the VA, my hours were lighter, for sure. The pediatric services, the surgeries tend to be much shorter. So even if I was there for a longer period, I wasn't necessarily in the OR for that whole time. I think in general, I was very lucky in terms of hours, working more reasonable hours than some of the other services. And you never really knew when you were going to get off, too. Some of the shift work I've been doing recently actually seems harder because you're going to be there for 14 hours or whatever the time rank is. But on surgery, things would ebb and flow depending on who showed up and, how the surgeries went. So that variation was good for me.
Oh. Where do you expect you'll be learning the best or learning the most on this rotation? So there's, you'll be making rounds, you'll be studying on your own, you'll be studying about your patients, you'll be in the library learning about Crohn's disease, you'll be in the operating room. Tell me how you imagine you will learn the best or the most.
I think one thing that I really have missed in the first years of medical school is not having that close relationship with the person who's teaching you. So, the first few years you have like the physician come in for 1 hour and then they're gone. And there's 215 students. So I think especially that was one of the reasons I did choose to work I requested to work at the VA, because there's a better, in general, at least where I am, there's a better student to physician ratio. And I really value like a relationship with the person that I'm learning from. So I think that'll be most helpful for me. Like I said, textbooks are great, but you can only get so much from them.
What did you find in terms of where you were learning?
Yeah, I think the VA versus my home institution thing comes into play again here in terms of because I was allowed to do more in the OR at the VA, I feel like I was more comfortable in the OR and I was able to ask more questions and have more hands-on knowledge in terms of actually like using instruments and learning anatomy. On my PEDS rotation, the attendings changed every day of the week. And so even though I was there for 4 weeks, they knew my name, but there wasn't sort of a relationship there. And I think partially because it was a PED service, we really weren't allowed to do very much in the OR, which I understand in terms of, risks. But so I think being in the OR at my home institution felt much more stressful and much less conducive to actual learning versus just like they would ask us rapid fire questions and we would spit back facts. That was kind of my impression of the OR where I am. But I did learn more on the floor. Like I said, I learned more about how to care for patients post-op and the sorts of questions you want to be asking them and the progress that you hope that they make after surgery.
Mm-hmm. Do you think you'll be studying for the test during this rotation?
For the shelf exam?
Uh-huh.
Yeah, definitely. We've actually already received, I don't know if this is unique to my school, but sort of a compiled list of all the books and resources that past students have used for the shelf exams and some advice for each rotation. So that's helpful. It's a little bit intimidating to see how much needs to be studied on top of the hours that you're putting in the hospital. But I'm assuming, and I'm sure I'll find out soon enough, that some of that studying can take place while you're in the hospital on like down hours.
So about the shelf exam, was that accurate?
Yeah, I ended up sticking to one book, and it was very slim, and I could carry it around with me. And I ended up reading it like multiple times and creating an outline of it. I think in terms of being able to study at the hospital, sure, there are like 15-20 minutes of downtime, in the pre-op area while you're waiting with your patient, and anesthesia is there and you're not required to be doing anything. But that's very hard to have quality study time when, everything's happening around you. And if you're trying to study in a team room, it's just as fruitless sometimes. So I would try and study for about 45 minutes to an hour every night. And sometimes I wouldn't get to it and I would just have to be okay with, going to bed early. And just, it was more important for me to be like refreshed for the next day and push studying to the weekends if necessary. Just because our hours were so long, I didn't want to be dragging for, a
Yeah.
whole shift.
Who do you think will
Yeah.
teach you the most? Your colleagues, the nurses, the interns, chief resident, attendings?
I guess it just depends on who is most willing to give me their time. I mean, I think it could be any of those, depending on, like, I want to be very open. Being like a patient myself for a lot of my life, I really respect like nurses, pharmacists, like everyone who's involved in the process. I think has a lot to teach me and all of my colleagues. So I just want to be open to that. As long as they're willing to teach me, I'll be happy to listen and learn from anyone who is in the OR.
So who taught you?
Definitely the residents. I think we spend very little time with the attendings, so they'll give you some tidbits here and there, which are wonderful. But you're with the residents all the time. For floor work, they were the most helpful. In terms of the actual OR, the scrub nurses were the ones who were really, especially starting out with surgeries, my first rotation, never having scrubbed in before. You go into the OR and you have no idea. I mean, they say like don't touch anything that's blue, but beyond that, you don't have a sense of the culture or where to stand or how you can help position the patient or all the basic things about moving the bed up and down. All those things you have to be taught, and the nurses were the ones who really showed me, and I was very appreciative of how patient they were.
Right. How do you think surgeons are different from other doctors, other specialties?
Well, there's more men. I think that it's really important for surgeons to establish trust with patients in a different way than other physicians. Obviously you have to have trust in any sort of physician-patient relationship, but especially I feel like with a surgeon, the patient is really putting their literally whole body under your care, and that's something that I'll be interested to see is how that trust is established, because I think it is really powerful and helps the healing process if the patient is on board with everything that's happening. I think it's sort of held true that it was more important for them to develop trust with the patients faster. So they tended, when they walked into a patient's room, to feel more authoritative, to me at least. I think a lot of the surgeons I interacted with, I was surprised by their amazing sense of humor in the OR. I sort of imagined going into the OR and like we're all focused and no one's going to listen to music and no one's going to, crack jokes or talk about their weekend. But my experience with surgeons was that they were very willing to engage, a lot of them, on a whole range of topics, and were much more open and funny than I imagined.
So how do you imagine the operating room culture? What's it going to be like to be in the operating room?
I imagine there will be, I think, sort of when you think about it, you're like, this is a very serious situation. Everyone's going to be, like laser beam focused. But these people are all professionals. I'm assuming a lot of these surgeries are things they do multiple times a day. I think the atmosphere might be a little bit lighter than I anticipate. Obviously very serious about the task at hand, but like joking and sort of talking back and forth. I think that that's definitely a possibility, but I'm sure it depends on the surgery and the sort of situation that goes with each patient.
Sure. So what else do you want to say about your anticipated general surgery clerkship?
Yeah, I guess probably what I'll end up going into is either internal or psychiatry. Those are my big interests right now. So for me, I guess I'm interested to see sort of how patients are tracked during surgery. So obviously, say someone has a GI issue, they have a gastroenterologist, and then they also have a surgeon. And how does the gastroenterologist and the surgeon interact? And what happens to that patient's care once the surgery is over? Like, I have no idea how any of that works. And that's something that like having continuity of care is really essential. So I think it'll be interesting to see the overlap between all the other doctors and the surgeons in the different hospital settings.
How do you imagine that dynamic, either historically or the dynamic between surgeons and other specialties?
I guess it I guess it just depends on I don't know. I would hope that
Do you
it
have a
would be
stereotype in mind?
um yeah, I guess I do.
So that's what I'm curious about. I want to know what
Yeah.
stereotype you've heard and where you think you learned that.
Well, there were some interactions between surgeons and other physicians during my preclinical years that were not super respectful. At one point, one of the surgeons was referencing another physician who is like the head of the that whole block. So the whole unit was under this physician's care. They referred, or multiple physicians referred, or multiple surgeons referred to this woman as just her without using her name or her title. So there was just small stuff like that that sort of makes me feel like a little bit uncomfortable. I'm sure that, and I hope that's not the norm at all, but I definitely have witnessed that in the classroom, and I wonder how that will be in the clinic as well.
Okay, so maybe some sexism is where you're heading with that, right?
There was a little bit of that, yeah. There was also, I do think to do a lot of these really drastic surgeries, you do have to think that your job is the most important job in some sense. There was a orthopedic surgeon who told us at one point, he said something like, "We're saving lives here. What other specialty can say that?" And I was like, "Oh, all of them, actually." It was kind of just it was a funny statement to me because
And that was an orthopedic surgeon?
Yeah, yeah. That was all. We're all sort of doing different pieces of the puzzle, and I think just having mutual respect is super important. But yeah, that maybe there's a little bit of sexism. I think if someone went into medical school fully committed to surgery and didn't really explore other options, they might see surgery as like the thing to do and not have as much openness to interacting with other physicians.
Okay. So you hinted at sexism and a sense of self-importance, or maybe a sense of superiority. I mean, your observations are fine, but it sounds like you're really
Yeah.
trying hard not to say those things.
Oh
But
yeah, well,
those are the stereotypes of a surgeon.
right. And I very much hope to be proved wrong multiple on all my rotations. But I do think going into surgery, a lot of students have these ideas about the way surgeons act. And so I wonder how that will influence the way that I respond if I do see those things in the physicians, and when I don't see those things, because you come in with these preconceived ideas, definitely.
Sure.
I think I was surprised by, I would say, again, the sort of like VA versus home institution breakdown holds true again, in that I think the physicians who were at the VA surprised me, who chose to work at the VA, because they were also linked to my home institution, of course, surprised me by just breaking a lot of the stereotypes that you sort of imagine a surgeon. Like, I didn't find any of them to exhibit any sexism. They weren't, they didn't seem to me like looking down on me as a medical student. Especially one physician was extremely good at asking questions that were exactly on my level of knowledge, which I really think is an amazing skill and very much appreciated. And then I think maybe it was just the culture of the more hierarchical setting of an academic institution. I found that a lot of the stereotypes came out more. Some of the male surgeons seeming much harder on the female residents. That was one thing that I noticed.
Interesting. Huh?
Some sort of impatience with nursing. Some of the stereotypes that you think of, not to any extreme, just in small amounts. Some of them held true.
What about final impressions on things you didn't expect?
I actually found at my school that the didactic sessions, which we had, I think, twice a week for 2 to 4 hours each session, were incredibly helpful. I think because of the specialties I chose, or just in general, I wasn't seeing like a very wide variety of surgeries. I was seeing spinal surgeries on neuro, and I was seeing like grafting and that kind of stuff on vascular. And then for peds, I was seeing a lot of like hernia repairs, which are all really important to see. But then there's this whole other swath of the surgical field that you don't ever see in an OR setting. And we did also have 2 days of trauma call, or one night and one day, and that was also very helpful. So I think my program made a big effort to sort of fill in the gaps, not only for general knowledge, but for the shelf exam, because the shelf exam doesn't care what specialties you did. They're going to ask you everything. Right. So I found that to be really helpful and not something that I was necessarily expecting.
Interesting. And you were thinking of psychiatry or internal medicine?
Mm-hmm, yeah.
And now you've had several rotations. Are you still heading in the same direction?
I am. I really loved my last 2 weeks. I was on labor and delivery. NOB is very interesting to me because it does have a very strong surgical aspect. But surgeons, at least from my experience so far, tend to look down on the OBs as like not real surgeons in some sense. But they're also doing clinical work and they're doing oncology. It's just a really wide range of things. And I don't think that I'm going to go into OB, but I've been very pleasantly surprised by how much I've enjoyed the different aspects of the service. But in general, I would say I'm pretty stuck on psych or possibly internal, yeah.
Good. Well, thanks for talking to me again. I appreciate you taking the time.
Yeah, thanks so much for having me.
Bye-bye. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.